The 2020 programme is a really fantastic programme which reaches parts of you that other leadership programmes don't.
The programme works very hard to integrate health and social care leadership development, which is something that we're extremely proud of.
First of all, you go with a bit of intrepidation. You're kind of a bit fearful of what's the programme going to be, what's it going to do for you. Am I going to fail? Am I going to look stupid? I think you have all of those reservations. But almost instantly when you get there, you realise that it's just a group of people that absolutely want to work with you, want to share their experiences and just want to learn together.
The programme in itself is a collaborative approach with system colleagues that sit on the programme board as well as the NHS Thames Valley Leadership Academy.
I'd highly recommend the programme. I've benefited hugely from all the different aspects of the programme. As a practice manager, I've been working with secondary care clinicians, managers from social services, people from all sorts of aspects of the STP, and I've grown enormously as a result of those different interactions and the programme itself.
On the first day, I didn't have a clue what they wanted from me, what was I doing there. It just wasn't, it was a structured course, but it didn't have the usual structure that nursing courses often have. And then I realised as time went on, they didn't actually expect anything from me. What they were doing was giving me tools so that I could go and make changes.
I think one of the things that was said immediately and as soon as we started on the launch was that it was a safe place, that there was no hierarchy, everyone was equal, and they wanted, the emphasis was on the fact that there was a safe place that everyone could have their say and you would be listened to, and that was 100% what happened.
As we do this, we are absolutely recognising the need to invest in our people, and they are our most valuable resource. Bringing them along with this journey, empowering them, equipping them. Ultimately, you're creating a culture of positive change that will attract new skill and attract workforce to the area.
I really enjoyed how the programme's been set up. The launch event in London was so memorable. Going to the House of Commons and listening to the MP speaking to us about the challenges of the Northern Ireland peace process really put everything in context in terms of if he did that and sorted out the Northern Ireland peace process, we should be able to sort out a few things within Frimley healthcare system.
So we've also had Greg Cyril, who's an Olympic medalist, who came to talk to us about his experience of success and failure, which is something that we don't often talk about, but it did resonate with many of us who've gone along journeys of trying something and not working out and trying again. And it is through the perseverance and keeping that momentum that their goals are reached.
For me, it was meeting, absolutely, Reverend Steve Chalk. He was massively inspirational. I think he was one of the key figures in the 2020, and he really helped us believe that change is possible, and really inspired us to really just go and attack and get that change.
So on our last residential, we were told that we were going to go and have a community dinner. I've never heard of a community dinner, so I had no idea what to expect, what to experience. We didn't know where we were going to go. We got a golden envelope an hour before we were setting off, telling us that a taxi would be picking us up and would be taking us on this journey. And we went to a homeless centre in Aldershot. And, my first experience of a homeless centre, so I didn't know what to expect. And they'd invited some of the homeless people that use the centre to come and have dinner with us. And it was just amazing to talk to those people. They felt absolutely privileged to be part of our programme and to be part of dinner with us. But I think it was more humbling for us to be part of their life.
My change challenge has been helping get Farnham Integrated Care Centre up and running. It's a same-day service for patients of 4 practices in Farnham, so I've worked very closely with partners and practice managers from those practices to make things happen. We finally opened on the 1st of June this year. We've got there and we're now in sort of the next iteration of how this same-day service runs.
My change challenge was a particular problem up in the northeast of part of Hampshire where we had a number of families who were experiencing challenges in getting their children diagnosed with autism or ADHD. So very long waiting lists, families were going into crisis, and actually just going and talking to groups of families, one, they felt empowered, they felt listened to, they felt as if we actually were interested in their problems and wanted to try and help them. And one of the things that they felt would really help them was just a simple website to enable them to navigate the system, to understand where the services are, how they access them, and what support was available to them on a day-to-day basis. The 2020 Leadership Programme supported the development of that website by giving them £1,000 towards that programme of work, and that enabled them to pay the web designer, to produce some of the materials, and to continue their work that they're doing to promote all of the, to promote access to the website, but also to share the information with parents. So their drop-in centres and support groups that they're setting up, it enables them to manage those meetings.
So my change challenge as part of the 2020 course has been to implement the Red Bag scheme across the care homes in Surrey Heath. The Red Bag scheme is this red bag here that is in nursing homes. Within that it has a folder which has information on the patient, demographics, whether or not they have a do not resuscitate form. It also gives some baseline information about the patient so that when they do go into hospital, the hospital knows what the baseline is and what has happened to them in the previous days, which has caused the admission to hospital. The aim of it is that the information that goes in will help to support treatment and care planning in the hospital, so to prevent either an admission or to reduce the length of stay.
So we've come up with a joint change challenge, and essentially it involves self-care and education, and we were hoping to, with the help of a secondary care consultant, to organise some educational workshops for a local deprived area, particularly focusing on conditions such as polycystic ovarian syndrome and fertility, and to really target a very specific audience with that.
This change challenge was inspired by one particular patient who attended the infertility clinic as part of Friendly Health. This lady was Asian. She was married abroad. She was from Pakistan, and she had a condition called PCOS. After she attended clinic, her family didn't understand, her husband and her mother-in-law didn't understand her condition. So they decided to take her back to Pakistan, said there was a family wedding, and then they left her. He divorced her, and they left her in the village. And she was shunned by the village because she was barren, or as they perceived it, barren. It was something that possibly just shouldn't have happened through a lack of education.
The 2020 has been a massive factor in helping make our change challenge reality. We're now just finalising some details, and more so about how we target the right audience and we get the information across. And so hopefully in January we'll be up and running.
One of the things I've done within setting up this integrated care centre is organised a health and wellbeing event alongside our flu clinic, and several hundred people coming through and getting advice on health education. We've produced leaflets to support that. So we're really working on the whole patient education, self-care, what's the best place to go for patients.
I'm almost 100% confident that from now and in the future it will help change patient outcomes. From my point of view, you're putting people in a room together from all across the NHS who are like-minded. Just being able to sit, talk, brainstorm with different ideas will just definitely improve how we're managing patients and just going to get better outcomes in the future.
2020 will also equip the fellows to challenge themselves and the system in creating the right culture environment for whole system collaboration and transformation.
Not only has it developed me professionally as a leader and in my style and in my approach to working within communities, but it's also helped me to manage my own personal well-being.
About halfway through the year, I went for a promotion within physio, and I was very lucky to be successful. But some of the feedback I got was that some of the reason that I'd got the job over someone else was because my knowledge of the bigger picture of the healthcare system of Frimley Health, and you know, everything we'd basically learnt on 2020 was so above what they'd seen in other candidates. So I have 2020 to thank for that, really.
Out of the 2020 course, I've been given the opportunity now to be able to pick up the phone to anybody that's been on the course, that we've connected with, and continue with the good work that we're doing across the system. This is not the end of the 2020 course for me. This is just the start of a journey of working greater and better within the SDP.
I'm extremely grateful for our system leaders who have been very supportive of the programme, allowed 2020 to become a reality, and giving that opportunity for our local workforce. On a personal level, it's been an absolute privilege to have been part of this programme, seeing how people develop and seeing what difference it really makes to improved patient care.